So in the cephalosporins, they will not ask you regarding the mechanism because it is same for that of penicillin as well as cephalosporins. What they can ask from cephalosporin, and they used to ask this question from classification: generations of cephalosporins. So you have to remember the generations of cephalosporin by any mean. So they are classified according to their generation. Each and every generation will have a different spectrum of activity. So what are the first generation cephalosporins? First generation cephalosporins, those given by oral route, like cephalexin and cepatroxyl. More examples also: cephalexin, cepatroxyl, and parenterally given cephazolin. Then second generation, according to the route of administration. So orally used second generation cephalosporins. So these are the second generation orally. Cefaclor, cefuroxime, azatil. Cefaclor, cefuroxime, azatil, and cepaprozil. Cefaclor, cefuroxime, azatil, and cepaprozil. And those used by parental route: cefuroxime and cephaloxime. Cefuroxime and cefoxitin. Cefuroxime and cefoxitin. Then third generation. So I will tell you, there is one trick to remember. Third generation orally used cephalosporin. Cefixime is there. Cefodoxime is there. Then cefdinir is there. Then cefibutin is there. Septamate pioxyl. Then parentally used, these are nothing but the cefotaxime, ceftriaxone, okay, ceftizoxime, ceftazidime, cefoperazone. These are the third generation parental. And fourth generation, there are only two examples in the fourth generation. They are given by parental route. They have already asked the question. Cefi, Pime. So you can Pime जो है Pyrone, Pime and Pyrone. These are the fourth generation. Pime and Pyrone. These are the fourth generation. फर्स्ट जनरेशन के लिए एक ट्रिक है आपको, बाद में मैं बोलूँगा. So you have to remember this. So first generation cephalosporins, those which are given by oral route, oral first generation. So cephalexin and cephalosporin, cephalexin and cephalosporin. So most of the first generation, they will have a CEPA in their structure, CEPA, CEFA, except this cephalexin. So all the CEPA, they are nothing but the first generation, except there is exception: CEPA, cephalexin, cephalosporin. Okay, then parental cefazolin. In second generation, orally cefaclor, cefuroxime, azatil, cefaprozil, and parental cefuroxime and cefoxitin. Then third generation oral cephalosporin, cefixin, cefodoxime, azatil or cefodoxime proxetil, cefdinir and ceftibutin, ceftamate pioxyl. Parental cefodoxime, ceftriaxone, then ceftazidime, cefopyrazone. And fifth generation is nothing but the cefipime and cefipyrone. You have to remember this classification is very important. General structure of your cephalosporins. This is the general structure for cephalosporins. Okay, so this ring is known as a cephalon ring. This ring is known as a cephalon ring. In case of penicillins, you have penum ring. In case of cephalosporins, you have a cephalon ring. So this is the cephalon ring, and this is known as 6-amino cephalosporinic acid. This part is known as 6-amino cephalosporinic acid. Now it consists of cephalosporins consists of a 7 amino cephalosporinic nucleus, not a 6, because यहाँ पे 6 member रहेंगे. So 1, 2, 3, 4, 5, 6 and this 7. So 7-amino cephalosporinic acid. So these cephalosporins, they are the derivative of 7-amino. Remember, first generation cephalosporins, cephalexin and cephalosporin, those are oral. Cefazolin is a parental. Second generation oral में आता है आपका cefaclor, cefuroxime, azatil and cefoprozil. Then parental में आता है आपका cefuroxime, then cefoxitin, and this cefoxitin. Now in third generation, in oral you will have cefixime, cefodoxime proxetil, cefdinir, then ceftibutin, ceftamate pioxyl. In parenteral you have cefotaxime, then ceftriaxone, then ceftriaxone, then ceftazidime, ceftazidime, then cefoperazone. And in the fourth generation, you have only two drugs which are given by parental routes, and they are cefepime and cefpyrone. So pime and pyrone. यहाँ पे pime and pyrone. These are the fourth generation. You have to remember. Now your cephalosporin will have a common structure like 7 amino cephalosporinic acid. So this is a 7 amino cephalosporinic acid ring. We'll see the details of structure activity relationship and all that in the another session. So cephalosporins they consist of a basic ring known as a 7 amino cephalosporinic ring. याद रखो 7 amino cephalosporinic nucleus. In the penicillins you have 6 amino penicillinic acid. So the ring present in the penicillin is known as a penum and ring present in the cephalosporin known as a sepum. There is only one difference, one carbon atom difference. Now cephalosporins, cepamycins are also these cepamycins. The cephalosporin consists of group of 2-3 antibiotics. So cephalosporin में 2-3 ग्रुप का एंटीबायोटिक्स होता है उनमें सेपामाइसिन भी आता है सेपामाइसिन्स आर आल्सो similar to cephalosporins but they are derived from actinomyces. Now cephalosporins they were isolated from one organism known as a Cephalosporium acromonium. Cephalosporium acremonium. Cephalosporium acremonium. Now mechanism action is similar to your penicillins. They act by inhibiting the cell wall synthesis of bacteria. In the similar way to that of penicillins, they will attach to penicillin binding protein that is nothing but the transpeptidase enzyme and they will inhibit the transpeptidase which will prevent the synthesis or cross-linking of your peptidoglycan layer in the cell wall of bacteria. So that's how bacteria will die. Okay. So cephalosporins will also act in a similar way as that of the penicillin. Penicillin क्या कैसे act करता है? They used to bind to penicillin binding protein, which are nothing but the enzyme that is transpeptidase, okay, which is responsible for the rigidization of bacterial cell wall. So it is responsible for the synthesis of peptidoglycan and cross-linking of peptidoglycan layer of the cell wall. Now penicillin, cephalosporins, they used to bind penicillin binding protein, transpeptidase enzyme. Both are the same, okay. Penicillin binding protein, they can be called as a receptor for penicillin. एक बार क्वेश्चन आ चुका है. So what are the receptors of penicillin? So they are nothing but the penicillin binding protein or transpeptidase. So one and same. So they will bind to transpeptidase, will inhibit the transpeptidase and will prevent the cross-linking of that peptidoglycan layer in the cell wall. That's why cell will cell cell wall will become faulty and bacteria will not survive with that faulty cell wall. Because if that cell wall is weak, then the fluid content present in the cytoplasm will come out and bacteria will die. And that bacteria will become vulnerable for the phagocytosis. So in the similar way, they act like penicillin. Now resistant to the cephalosporins slowly develops and it is developed slowly mediated by other bacterial beta-lactamase. So those bacteria which produces the beta-lactamase enzyme, they are resistant to penicillins as well as cephalosporins. And also they decreases the permeability to the drug. So drug will not get entry into the cell wall easily. Cross resistance to other beta-lactam antibiotics. So if you are resistant to penicillins or if you are resistant to cephalosporins, that means you are resistant to all beta-lactam antibiotics. So cross resistance मतलब क्या penicillin का structure अलग है. If you are resistant to penicillin and if you use cephalosporin में भी आपको कोई इफेक्ट नहीं मिला. That means this penicillin cephalosporins they have cross resistance to each other. Resistance होता है. So if you are resistant to cephalosporin, that means penicillins will also be not effective in your infection. So that is a cross resistance. Antibacterial activity. So they are active against the variety of gram-positive and gram-negative bacteria. Effective against the pneumococci, then Corybacterium diphtheria, group A beta hemolytic streptococci, active against the staphylococci. No cephalosporin is available at present which is active against the Streptococcus faecalis. So they are not active against the Streptococcus faecalis. There is no cephalosporins available today, which is active against this organism, Streptococcus faecalis. Now, gram-negative organism, that is a gram-negative organism, those which are susceptible for to these antibiotics, they are nothing but the E. coli, Neisseria gonorrhoeae, Salmonella typhi. So ये जो बाकी के organism है, they are susceptible, means cephalosporin will be effective in these organism infection, like your E. coli, then Neisseria gonorrhoeae, then Salmonella typhi and Shigella. So these organisms, they are sensitive or they are susceptible to cephalosporins, but there is no cephalosporins which is available which is active against Streptococcus faecalis. तो ऊपर वाले जो ऑर्गेनिज्म है ऐसे और नीचे वाले, so cephalosporins are active against them, but it is not active against Streptococcus. Now we'll see the next. Okay, absorption, distribution, metabolism, and elimination. Like the penicillins, they are also given by intramuscular route, intravenous route, and also oral route. So intramuscular injection, they are painful and they are mostly eliminated by renal tubular secretion. So cephalosporins, they are eliminated by renal tubular secretion, and that's why anything that can decrease or anything that can decrease the elimination of cephalosporin will increase the bioavailability. So propenicillin can increase the plasma levels of cephalosporins. Cefotaxime is a partly metabolized in the liver before excretion. Most of the cephalosporin, they are not metabolized. Cefotaxime is partly metabolized in the liver before excretion. What are the adverse reactions? So locally they can cause thrombophlebitis if given by intravenous injection. There will be inflammation and swelling and edema of the vein, that is thrombophlebitis. As like penicillin, they also have allergy like skin rash, fever, serum sickness, asthma, then urticaria. They are also reported. Anaphylactoid reactions also been reported. Neutropenia, transient splenomegaly. So spleen आपका enlarge हो जाएगा. Transient splenomegaly means enlargement of spleen. Post treatment of cephalosporin, super infection can be occur. So super infection that can occur with the third generation broad spectrum cephalosporins. Remember, they have nephrotoxicity. Large doses of cephalosporins, they will have nephrotoxicity, and it can be reversed by withdrawal of therapy. कि आपको अगर टैबलेट चालू है, कोई नेफ्रॉन में प्रॉब्लम आ जाएगा, so if you got a nephrotoxicity, you have to withdraw that drugs. It will be relieved. Toxicity can be increased by use of loop diuretics. Now concurrent use of loop diuretics like furosemide, okay, concurrent use of loop diuretics, furosemide and cephalosporins. So furosemide क्या करेगा, cephalosporins का जो nephrotoxicity उसको बढ़ाएगा. So concurrent use of loop diuretics and this cephalosporins will increase the nephrotoxicity. Again, concurrent use of cephalosporins and aminoglycosides. Nephrotoxicity of cephalosporins will also be increased by aminoglycosides. ये दोनों ड्रग आपका इसका टॉक्सिसिटी बढ़ाएंगे, aminoglycosides and furosemide. Then blood related toxicity, that is bleeding, hypoproteinemia, abnormality of platelet aggregation. Okay, so these are the problems with the cephalosporin. So abnormality of platelet aggregation that can be prevented by vitamin K therapy. So it is a mostly they will prevent the aggregation. So like anticoagulant action. Okay, common drug with this methyl tetrazole substitution. Okay, so particularly third generation cephalosporin like cefoperazone and ceftriaxone, they can cause the dysfunction of platelet aggregation. And again, they can produce a disulfiram-like reaction. When taken with alcohol, particularly new cephalosporins like cefoperazone, they causes neutropenia, thrombocytopenia. That is possible with the ceftazidime. Most common adverse effect of this cephalosporin, that is a drug fever. Cephalosporins are amongst the common cause of drug fever or drug allergy, drug fever. तो ड्रग लेने के बाद में आपको टेम्परेचर बढ़ेगा. सो मोस्ट कॉमन कॉज ऑफ ड्रग फीवर इज नथिंग बट द cephalosporins. ये थोड़ा सा नेफ्रोटॉक्सिसिटी याद रखो, ब्लड टॉक्सिसिटी विद थर्ड जनरेशन cephalosporins, सुपर इन्फेक्शन विद द थर्ड जनरेशन cephalosporins. सो सपोज थर्ड जनरेशन cephalosporins आपको दिया है सेफ्ट्रैक्सोन, सेफीपायरोन वगैरह. So after treatment you are vulnerable for another infection, that is known as super infection. Therapeutic uses, यूजेस क्या है इसके? सो फर्स्ट लाइन ड्रग्स, दे आर इफेक्टिव अगेंस्ट द ग्राम पॉजिटिव एज वेल एज ग्राम नेगेटिव ऑर्गेनिज्म. Cephalexin, Cepodem, okay, Cepodem, Cephalosporins still has been used in usefully treating the community-acquired respiratory tract infection and surgical prophylaxis. So जो first generation cephalosporins होता है, so these drug mostly used for respiratory tract infection. Okay. So particularly Cephalexin and Cepodem, they are useful in the community acquired respiratory and urinary tract infection. So RTI as well as UTI, they are used to treat respiratory tract infection plus urinary tract infection, and also used in the prophylaxis of surgery, surgical prophylaxis. जैसे आपको कोई सर्जरी हुआ है, आपका सर्जरी होने के बाद में क्या होता है कि इन्फेक्शन का चांस होता है. So if you want undergone a surgery, there is a chances of getting infection at that place. So to prevent that, these cephalosporins are used. So prevention is prophylaxis. So to prevent the infection after surgery, it is a surgical prophylaxis. Now cefazolin is a drug of choice for surgical prophylaxis. याद रखो, drug of choice for surgical prophylaxis, that is a cefazolin. Okay. Now second generation cephalosporins, they will cover more infection than first generation. They are active against gram negative also, then H influenza, Haemophilus influenza, third generation. So they are more active against the gram negative vessel than second generation. They are used in ammonoglycoside resistant infections, multi-drug resistance negative bacillary systemic infection. So remember, इसके ऊपर क्वेश्चन आ चुका है. Ceftriaxone is a first drug of choice for gonorrhea. Then it is also used in the therapy of meningitis. Okay, cefotaxime is metabolized to active metabolite known as a diacetyl cefotaxime. So ceftriaxone is a first drug of choice for gonorrhea, and nowadays it is also drug of choice for treating the typhoid fever. टाइफाइड के लिए भी इसका ही ड्रग ऑफ चॉइस है. एंड सेपोटेक्सिम इज active, it is a prodrug metabolized to one active metabolite, that is a desacetyl cefotaxime. Now fourth generation cephalosporins, they are mostly effective against the gram negative infection, including infection of CNS because of the more rest because of microorganisms which are resistant to. So fourth generation cephalosporins, they are used for the infection including CNS infection, because these fourth generation cephalosporins, they are resistant to beta lactamase. Now this cefepime, it can penetrate into CSF, and that's why it is used in the treatment of meningitis and all that. Cefepime that can penetrate into CSF. Cefotaxime, ceftriaxone, they are used in the urinary tract infection, respiratory tract infection, then joint and soft tissue infection caused by gram-negative organism. They are also used for surgical prophylaxis and at surgical prophylaxis of artificial heart valve. अगर आपका कोई bypass surgery या heart valve का surgery हुआ है, so for the prevention of infection, these drugs are used. Artificial joint, they are also used in the treatment of meningitis, gonorrhea, typhoid. So ceftriaxone is a drug of choice in the typhoid. Again, ceftriaxone is a drug of choice in the gonorrhea. Again, they are used in the mixed infection like aerobic and anaerobic microorganism, like in a cancer patient, then collateral surgery, obstetric complication, hospital-acquired infections. They are also used in the prophylaxis of neutropenic patient. Third generation cephalosporins are used. Septicemia, aminoglycoside along with the cephalosporin, they are used to treat the septicemia. Now, generations of cephalosporins. Then you have to remember these generations. इसके ऊपर क्वेश्चन आता है. So first generation cephalosporins, parenterals and oral. First generation में parenteral में क्या आता है? Cephalothin and cefazolin. First generation में oral में क्या आता है? Cefodoxil, cephalaxin and cefaredin. तो देखो यहाँ पे cephalaxin, cefodoxil, cephalothin and cefazolin. Then second generation cephalosporin, they are more active against the gram-negative organism and some anaerobes. None of is effective against the Pseudomonas aeruginosa. So those taken by parenteral, ciprofloxacin and cefoxitin and cefuroxime. Then orally, cephalosporin acetic. third generation cephalosporins. They are highly effective against the gram-negative. Then enterobacteria and some from them are also effective in the Pseudomonas aeruginosa. Less active against the gram-positive. Third generation में क्या आता है कि they are more active against the gram-negative than gram-positive. So those used by parental cefotaxime, ceftriaxone, okay, ceftriaxone, then ceftazidime, and those used by orally like cefixime, cefodoxime proxetil, sapadinil, and ceftibutan. Then fourth generation cephalosporins. Last method, they are resistant to beta lactamase and also inhibit the Pseudomonas aeruginosa and Staphylococcus aureus. जो fourth generation होता है, they are known as a broad spectrum. So they are only parenteral drugs are available like cefepime and cefepirone. Pime and pyrone both are the fourth generation. Now in that next one is carbapenem. So imipenem, okay, imipenem. Carbapenem में आता है imipenem. Imipenem. So it is again a beta-lactam antibiotic obtained by modification of parent antibiotic known as thiamycin. It is obtained from Streptomyces catalea. Streptomyces catalea. This drug inhibits the cell wall synthesis of bacteria. It is better tolerated and has a wide spectrum of activity than cephalosporin. Highly effective against the gram-negative aerobes, including Pseudomonas aeruginosa. It is a beta-lactamase resistant and also active against the chlamydia and mycoplasma species. Carbapenems. So they are ineffective in case of intracellular organism because they do not get entry into inside the cell. Okay, so they do not penetrate cellularly. So cellularly, therefore, they are less effective in case of intracellular drugs. They are hydrolyzed by dipeptidase in the kidney. Therefore, it is combined with the celestine, known antibiotic, which is inhibitor of renal dihydropeptidase to increase their bioavailability. So this carbapenem, particularly imipenem, is combined with the celestine. Celestine, it is a non-antibiotic compound which inhibit the dihydropeptidase present in the kidney. तो क्या होता है कि इमिपेनम जो है वो किडनी में क्या होता है हाइड्रोलाइज होता है उसका डिहाइड्रोपेप्टिडेज नाम का एंजाइम है किडनी में वो हाइड्रोलाइज करता है सो अगर हाइड्रोलाइज करेगा तो इमिपेनम का बायो अवेलेबिलिटी कम हो जाएगा सो यू हैव टू इनहिबिट दैट एंजाइम बाय यूजिंग दिस celestine now adverse drug reaction they are similar to other beta lactam antibiotics commonly nausea vomiting reactions transient elevation of liver enzymes in the blood pseudomembranous colitis. This is a specific adverse event. Uses क्या है इसके highly effective. It is useful in the gram positive as well as gram negative aerobics and anaerobic microorganisms. Useful, its use is restricted to in the treatment of mixed infection and resistant to gram negative infection. It should not be used in the meningitis. Meropenem, not susceptible for renal dipeptidase. यहाँ पे याद रखो imipenem जो है imipenem that is hydrolyzed by dihydropeptidase present in the kidney, but meropenem is not susceptible. So in case of meropenem, you don't have to give this celestine. Meropenem क्या है? Meropenem is not susceptible for renal dipeptidase. So meropenem में celestine use नहीं करना है. Ertapenem is there, broad spectrum, daily IV dose. Then that is a carbapenem. Okay. So meropenem is a newer drug from carbapenem. Imipenem was older. Meropenem is there. Meropenem is also used nowadays also. Not hydrolyzed by renal peptidase and it is a reserved drug for serious nosocomial infection like septicemia, severe neutropenia, intra-abdominal and pelvic infection. So meropenem is a रिजर्व ड्रग इसके लिए अभी तक उसको ठीक है अभी तक उसको रेजिस्टेंस नहीं आया है मेरोपेनम को अगर आ गया तो फिर एंटीबायोटिक नहीं है अपने पास सो मेरोपेनम इज नॉट hydrolyzed by renal dipeptidase and it is reserved drug for treatment of serious nosocomial infection and septicemia, severe neutropenia, intra-abdominal and pelvic infection. Now you can see over here again how to memorize that generations. So generations कैसे याद रखना है? Okay. So first generation All drugs having A after CFE, मतलब CEPA, CEFA. So they are first generation except Cepaclor. Cepazole, like ठीक है. So CEPA जिसमें आएगा वो first generation है. So all drugs which consist of CEPA, they are the first generation except CEPA. Okay, except there is one drug. Okay, so example Cephazolin, Cephalosporin. Okay, Cepha. Okay, they are the फर्स्ट जनरेशन. और सेकंड जनरेशन कैसे आता है? ये फोर्थ जनरेशन वाले पी आई रहेंगे उसमें, पाइम एंड प्रोम, सेफापाइम एंड सेफाप्रोम. पी आई वाले फोर्थ जनरेशन. तो फिफ्थ जनरेशन भी है. रोल वाले फिफ्थ जनरेशन, लाइक सेफ्टी बाय सेफ्टी बी पायरोल एंड सेफारोलाइन, सेफारोलिन. दीज आर द फिफ्थ जनरेशन. थर्ड जनरेशन कैसे आता है? ड्रग एंडिंग विद generation, ending with, so drug ending with me, that is ciprexim. Okay, ciprexim, cipodoxim. me में जो me end होता है, ciprexim, cipoxim. Okay, cephalosporin, then cipodoxim, then cipexim, ceftazidime. Okay, cefotaxime. Okay, ceftriaxone. Okay, okay, so drug ending with me and drug ending with one, ceftriaxone, cefiperazone, ceftriaxone, 10. So own, me and 10. जिसके लास्ट में me आएगा, जिसके लास्ट में own आएगा, जिसके लास्ट में 10 आएगा. So those are nothing but the third generation. So those ending with the me, then your own and 10, they are nothing but the third generation. So those ending with me except ciproxim, cefixim, cipodoxim, trazine, cipodoxim, ceftriaxone. All these are the third generation. तो यमी वाले थर्ड जनरेशन है, ओन वाले थर्ड जनरेशन है, एंड 10 वाले थर्ड जनरेशन है, एंड रेस्ट ऑफ द ड्रग्स लाइक दे आर नोन एज सेकंड जनरेशन. तो एक ऐसा ट्रिक बना कि आप ये याद रख सकते हो. ज़्यादा कोई कुछ इम्पोर्टेंट नहीं है इसमें, बाकी तो सभी सेम है. जैसे वही यहाँ पे दिया है. फर्स्ट जनरेशन. ओके, फर्स्ट जनरेशन ओरल सेफेलेक्सिन, सेफाडोक्सिल, सेफेलोरेडिन, सेफेराडिन, cephalosporin, cephalosporin, cephalaxin. These are the oral. Okay. यहाँ पे देखो CEPHA, CEPA, CEFA, CEPHA, cephalosporin. Okay. Cephazolin is nothing. Cephazolin is nothing but parenteral. Now second generation oral में आएगा cephaclor, cephaloxim, axidyl, then cephalosporin. पेरेंटल में आएगा cephaloxim. नहीं नाम दिए, इतना जरूरी नहीं है आपको. आपको सिर्फ इम्पोर्टेंट, एटलीस्ट जो इम्पोर्टेंट है वो याद रखना है. थर्ड जनरेशन में आता है सेफिक्सिम, यमी वाले. थर्ड जनरेशन में यमी, लास्ट में यमी, सेफिक्सिम. यहाँ पे सेपोडोक्सिम. 10 वाले सीपीब्यूटेन. ठीक है, 10 वाले भी है, 10 वाले भी है, एंड जोन वाले ओ यमी, यमी एंड 10. ये है थर्ड जनरेशन. जिसके भी लास्ट में यमी आएगा, सो दीज आर नथिंग बट द थर्ड जनरेशन. जिसके भी लास्ट में 10 आएगा, जैसे ये सेफीब्यूटेन, जिसके भी लास्ट में 10 आएगा वो थर्ड जनरेशन होगा. जिसके भी लास्ट में ओन आएगा फिर सेफिपेराजोन, जैसे सेफ्ट्रैक्सोन, सेफ्ट्रैक्सोन, सेफिपेराजोन, यमी, ओन एंड 10. दीज आर द थर्ड जनरेशन. पाइम एंड प्रोम, ये जो है दैट इज अ फोर्थ जनरेशन. एंड फिफ्थ जनरेशन रोलिन एंड रोल, रोलिन एंड रोल, रोलिन रोल, फिफ्थ जनरेशन. So prime prom, fourth generation. Okay, yummy, then ONE and 10. These are nothing but third generation. बाकी के second generation. Second generation में आपको simple याद हो जाएगा. Chemistry of cell. So these penicillins and cephalosporins, they have difference in their basic structure. So penicillins are nothing but they are the derivative of 6-amino penicillinic acid. Cephalosporins are the derivative of 7-amino cephalosporinic acid. You can see here. यहाँ पे extra है ना कार्बन. So 7-amino cephalosporinic acid, that is cephalosporin, and 6-amino penicillinic acid, that is penicillins. So all the penicillins are derivative of 6-amino penicillinic acid. So this is the site where beta lactamase will act. So those organism which produces the beta lactamase enzyme, so they opens this bond. And there is one more enzyme known as amidase. So amidase will break this bond. So ये amide bond जो है ना वो break करेगा amidase. नाउ नोमेनक्लेचर ऑफ पेनिसिलिन, ऑलरेडी इसके ऊपर क्वेश्चन आ चुका है. So chemical extract, according to the chemical abstract, they are known as a 4-thia, 1 as a bicyclo, 2 okay, 4-thia, 1 as a bicyclo, 3.2.0 heptanes. ये आपको याद ही रखना पड़ेगा. देयर इज नो अदर ऑप्शन. बस उतना ही है कि सेफलोस्पोरिन में ऑक्टेन आता है, यहाँ पे हेप्टेन आता है, बाकी सब सेम है. सो केमिकल एब्स्ट्रैक्ट नेम 4-thia, 1 as a bicyclo, 3.2.0 heptane. Okay, this nomenclature they already asked in the exam. 4-thia, 1 as a bicyclo, 3.2.0 heptane. तो यहाँ पे आप देखो दे आर 7 मेंबर रिंग. ये 4 मेंबर इसके हो गए, 4 मेंबर हो गए, 5, 7 and 6, 5, 6, 7. Okay, so 4 plus 3, 7. So that's why heptane. 4-thia, 1 as a bicyclo, 3.2.0 heptane. That is a chemical abstract name of penicillin. Okay. Then benzyl penicillin का नाम क्या होगा? So benzyl penicillin as per the chemical abstract, benzyl penicillin 6 into 2 phenyl acetamide, 3 dimethyl 7 oxo 1 7 oxo 4-thia, 1 as a bicyclo. तो ये बाद में तो ये 9 कॉमन रहेगा, बस यहाँ तक ही. सो 6 into 2 phenyl acetamide, 3 dimethyl 7 oxo 4-thia, 1 as a bicyclo, 3.2.0 heptane. That is a chemical abstract name of your benzyl penicillin or penicillin G. Now what is meant by penum ring? Penum is unsubstituted basic skeleton. Penicillins are 6 acyl amino, 2,2-dimethyl penum, 3 carboxylate. Acyl amino, यहाँ पे 6 acyl amino, जो ये acyl amino. Clear this? Penum ring that is present in the penicillins. Okay. What is the name? 6 acyl amino, 2,2-dimethyl penum, 3 carboxylate. So 6 acyl amino, 2,2-dimethyl, 2,2-dimethyl penum, ये पूरा रिंग को अपन penum बोलेंगे, penum, 3 carboxylate. So that is the ring. Okay, penum ring present in the penicillins. Beta-lactam antibiotics contain 4-membered ring fused with the nitrogen and tetrahedral carbon atom to heterocyclic ring. Different beta-lactam antibiotics कितने होते हैं? First, penicillins. So beta-lactam antibiotics में आता है penicillins. So in that ये ring system important है, इसके ऊपर भी क्वेश्चन आता है. So in case of penicillin, beta-lactam ring is fused with the thiazolidine ring. Thiazolidine ring, remember. Now in case of thiamycins, beta-lactam ring is fused with the pyrroline ring. In case of this thiamycin, beta-lactam plus pyrroline ring. Penicillins, beta-lactam plus thiazolidine ring. Clavulanic acid में beta-lactam plus oxazolidine ring. Okay, so clavulanic acid या फिर beta-lactam is inhibitor. So in that beta-lactam plus oxazolidine ring. Cephalosporin में क्या है? देखो क्वेश्चन इसके ऊपर आता है आपको. Beta-lactam plus hydrothiazine ring. Hydrothiazine. This one is a beta-lactam ring. So in case of cephalosporins, beta-lactam ring is fused with the 6-membered dihydrothiazine ring. In case of penicillins, so it is combined, beta-lactam ring is fused with the 2-membered thiazolidine ring. ये याद रखो आप, क्वेश्चन आता है इसके ऊपर. Now degradation of penicillins. So your penicillins are not stable in the acidic condition or basic condition. So penicillins, they are not stable. Penicillin, okay, under acidic condition getting penic acid. Okay, you are getting phenolic acid. Under alkaline medium you are getting penicilloic acid. तो अगर आपको penicillin basic medium में डाल दिया आपने, so what will happen? So there will be opening of this bond, penicilloic acid, and in the acidic medium you are getting phenolic acid. In the acidic medium you are getting phenolic acid. So degradation of penicillin इसके ऊपर भी क्वेश्चन आता है. So what will happen in case of acidic medium and what will happen in case of basic medium? So penicilloic acid is the product when penicillins are placed in the basic medium. When penicillins are degraded under acidic medium, phenolic acid. तो यहाँ पे कंफ्यूज नहीं होना. सिलोइक basic leak. You can see again here. This is a penicillin structure under basic condition or base OH minus ions. So penicilloic acid is there. This bond is open over, and under the acidic condition, penicillinic acid. After that, penimendelic acid is there, and lastly, you're getting penicillamine. Penicillamine. Now this penicillamine is used in the. It is a chilling agent. Penicillamine. D-penicillamine is a chilling agent. After that, penedylic acid and penicilloaldehyde. So this is a degradation product of penicillin. Penicillin का अगर acidic condition में क्या होगा? So under acidic condition, penylic acid will be there. From penicillin, penylic acid will be there upon acidic condition. If you degrade this penicillin by using basic medium, penyloic acid will be there. Question already आ चुकी है. Structure activity relationship of penicillins. So what are the different possible substitution on the penicillins? पहले substitution कहाँ पे work कर सकते हैं आप बोल देते. So you can use this acyl side chain, 6 amino acyl chain. Then you can change this also. These are the two possible substitution, and you can also change one of the carbon from this. These are the possible modifications for penicillins. Now we'll see the star. So 6 acyl side chain substitution on primary amine should be electron withdrawing groups. So which will decrease the electron density on the side chain and protect the molecule from acid degradation. तो 6 अमीनो साइड चेन है उसमें क्या है इलेक्ट्रॉन विड्रॉइंग ग्रुप्स होने चाहिए जो कि आपके साइड चेन में इलेक्ट्रॉन डेंसिटी कम करेंगे एंड दैट इलेक्ट्रॉन डेंसिटी कम करेंगे और वो मॉलिक्यूल ज़्यादा स्टेबल रहेगा एसिड. देन further substitution on alpha carbon atom such as amino or chloro or guanidino increases the further resistance toward the acid. तो alpha carbon atom मतलब कौन सा यहाँ पे CH रहेगा है ना C और बाद में यहाँ पे इसके नीचे दिस alpha carbon यहाँ पे क्लोरीन हाइड्रोजन क्लोरीन हाइड्रोक्सिल और guanidino ग्रुप रहेगा that will give more acid stable. Other substitution on alpha carbon such as amino which is present in the ampicillin. Ampicillin में वहाँ पे amino रहेगा alpha carbon. Then chloroguanidino further increases the resistance toward the acid. Penicillin G is the susceptible for the acid and alkali both. Penicillin G acid में भी destroy हो जाएगा, alkali में destroy हो जाएगा, but ampicillin नहीं होगा. क्यों? Because amino group is present on the alpha carbon atom. So that will further increase the stability towards the acid. Then third, increase in the length of acyl side chain by acylation. In the length of side chain, यहाँ पे थोड़ा spelling mistake है यहाँ पे. Let it go over here. So increase in the side chain, acyl side chain by acylation of 6 amino penicillinic acid gives better activity. Chain increase करेंगे तो activity बढ़ जाएगी. Substitution on alpha carbon aryl or alkyl group in the side chain resulting in the increased stability for oral absorption. तो अल्फा कार्बन एटम जो है उसके ऊपर अराइल CH2 अराइल मतलब आपका ये फिनाइल रिंग होता है. सो फिनाइल रिंग aromatic ring are placed on alpha carbon atom or alkyl group that in the side chain will result in the increased stability and oral absorption. Substitution of bulky groups on the alpha carbon atom increases the beta-lactamase resistance. जो alpha carbon atom मतलब होता है उसके ऊपर अगर bulky group डाल देंगे आप having high molecular weight group, so that will increase the resistance. For example, methicillin, nepsilin. Nepsilin में क्या है? Nepsilin में naphthalene होता है. Nepsilin में आता है naphthalene. Then oxacillin. So they are resistant to beta-lactamase. So introduction of bulky group on alpha carbon atom, the molecule becomes resistant to beta-lactamase. Okay. All these are having aromatic ring attached to a side chain. Ortho substitution responsible for the penicillin resistance. बाद में structure तो देखेंगे अपन बोलूँगा. Dextroisomer is more active than levoisomer. So dextroisomers of penicillin there is a 2 to 8 times more active than levoisomer of penicillins. Amoxicillin has a polar group at alpha position, the side chain of which increases the activity against the gram-negative bacilli. Okay. So amino group, hydroxyl group, carboxylic group, sulfate group increases the activity against the gram negative in case of ampicillin, amoxicillin, and carbonicillin. तो अल्फा कार्बोनेट पे कार्बोनिसिलिन में कार्बोक्सिलिक ग्रुप है, ठीक है, एम्प्लिसिलिन में अमीनो ग्रुप है, ठीक है, ठीक है, और अमोक्सिसिलिन में हाइड्रोक्सिल ग्रुप है, दैट्स व्हाई। सो दिस सभी चेंजेस वहाँ पे, तो साइड चेन में अल्फा कार्बोनेटम पे मैक्सिमम वहीं पे चेंजेस होते हैं। नाउ इफ असाइन साइड चेन इज रिप्लेस्ड बाय hydroxymethyl groups which gives increased activity against the gram negative. Introduction of C6 alpha methoxy group gives beta lactamase resistant compound like N-acetylated ampicillin. They are effective against the pseudomonas, uropenicillins. So first is nothing but the again esterification of that carboxylic group. तो COH group है आपस third position पे. So esterification of COH group at third position, they will give you prodrugs with increased lipophilicity and acid stability. For example, in case of ampicillin and bicampicillin, both are the prodrugs. तो होगा यहाँ पे जो कार्बोक्सिलिक एसिड है ग्रुप वहाँ पे esterification होता है, so that will give you prodrugs. So these are the few important points from SAR. SAR स्लीप में इतने ही important point है. Then in vitro degradation can be prevented by keeping the penicillin at a pH range 6 to 8. More lipophilic side chain can lead to more protein binding of drug. Ampicillin is 25% bind, phenoxymethyl penicillin is 75% protein bond. मतलब क्या है, जो साइड चेन में जितना ज़्यादा लिपोफिलिसिटी होगा उतना ज़्यादा गुड प्रोटीन बॉन्ड करेगा. तो एम्प्लिसिलिन में कम है, एम्प्लिसिलिन में कम लिपोफिलिसिटी है, तो दैट विल बाइंड टू 25%. phenoxymethyl penicillin इसमें इसमें लिपोफिलिसिटी ज़्यादा है तो इट विल बाइंड 75. सो फर्स्ट पेनिसिलिन इज रेजिस्टेंट पेनिसिलिन इज ससेप्टिबल पेनिसिलिन. तो ये पेनिसिलिन डिस्ट्रॉय किए जाते हैं पेनिसिलिन से. सो फर्स्ट इज अ बेंजाइल पेनिसिलिन जी. सो यहाँ पे देखो ये तो कॉमन है, ये स्ट्रक्चर कॉमन रहेगा, बेंजाइल पेनिसिलिन में सिर्फ फिनाइल रहेंगे वहाँ पे और बेंजाइल रहेंगे, ठीक है. और फिनॉक्सीमिथाइल पेनिसिलिन, तो ये फिनॉक्सीलिन डालो, ये निकल के फिनॉक्सी, तो सिर्फ ऑक्सीजन ऐड करोगे, ओनली दिस चेंज. So phenoxymethyl penicillin. So penicillin G is a benzyl penicillin and penicillin V is the phenoxymethyl penicillin. Phenoxymethyl penicillin, because of the introduction of that oxygen, so it is a less resist. It is a acid resistant due to impairment of that oxygen and phenyl ring. So it is a acid resistant. Then penicillin is resistant penicillin. First one is a methicillin. मिथिसिलिन में क्या है, बस इतना ही है, फिनाइल रिंग और उसके दोनों ऑर्थो पोजीशन पे मिथॉक्सी ग्रुप. सो डाइमिथॉक्सी फिनाइल. ओके, तो इसको आप ये जो स्केलेटन है इसको बोलेंगे 6 अमीनो पेनिसिलिनिक एसिड, ये जो स्केलेटन है. सो 6 into 2,6 डाइमिथॉक्सी फिनाइल 6 अमीनो पेनिसिलिनिक एसिड, दैट इज अ मिथिसिलिन. अभी नेम भी इजी होता है, यू कैन राइट. तो इसका जो पूरा स्ट्रक्चर है इसको आप बोलेंगे 6 अमीनो पेनिसिलिनिक एसिड. बाकी क्या बचा है, 6 अमीनो पेनिसिलिनिक एसिड, ये जो पूरा स्ट्रक्चर है. सो क्या अटैचमेंट है यहाँ पे, सो दिस इज कार्बन नंबर 1 2 3 4 5 6. सो सॉरी 1 2 3. ओके, सो 1,3 dimethoxy phenyl 1,3 dimethoxy benzene 2-यल 6 amino penicillinic acid, that is our name. Now oxacillin is the penicillin is resistant ampicillin, penicillin is resistant penicillin. So oxacillin में क्या है, oxacillin cloxacillin dicloxacillin and flucloxacillin. Okay, so these are the similar structure. So basic structure ये रहेगा उसमें. So oxacillin में यहाँ पे क्या रहेगा, हाइड्रोजन रहेगा, यहाँ पे भी हाइड्रोजन रहेगा. ऑक्सीजन में, क्लोक्सासिलिन में एक जगह पे एक हाइड्रोजन की रिप्लेस करो क्लोरीन से, दैट विल बिकम अ क्लोक्सासिलिन. नाउ डाइक्लोक्सासिलिन मतलब दोनों भी R1 R2 क्लोरीन करो, दैट इज अ डाइक्लोक्सासिलिन. एंड फ्लोक्लोक्सासिलिन मतलब एक क्लोरीन. सो इतना सिंपल है. सो दिस इज अ कॉमन स्ट्रक्चर 6 अमीनो पेनिसिलिनिक एसिड. उसके वहाँ पे जितना ज़्यादा लिपोफिलिसिटी बढ़ेगा उतना ज़्यादा पेनिसिलिनेज रेजिस्टेंस बढ़ेगा। सो दैट्स वाई यहाँ पे क्या है, ऑक्जेजोल रिंग है, क्लोक्जे। ओके, क्लोक्जे मतलब क्या है, क्लो मतलब क्लोरीन, ऑक्जे मतलब ऑक्जेजोल रिंग, आइसोक्जेजोल पर्टिकुलरली। सो आइसोक्जेजोल, सो क्लोक्जे, डाइक्लोक्जे, फ्लोक्लोक्जे, सब ऑक्जेजोल रिंग है। देन निपासिलिन, निपासिलिन में आता है आपका नेप्थेलिन रिंग, methoxy naphthalene ring. So again it is a penicillin is resistant penicillin. Then amino penicillins. So in that you have ampicillin. So difference is here only. So यहाँ पे amino group है alpha carbon atom है. This one is known as alpha carbon atom. So amino group on alpha carbon atom. This is ampicillin. Ampicillin में यहाँ पे hydrogen है सिर्फ. Amoxicillin में यहाँ पे OH group है सिर्फ. बाकी स्ट्रक्चर सेम है. बिकम्पिसिलिन, बिकम्पिसिलिन एम्पलीसिलिन का स्ट्रक्चर एज इट इज निकालने का बस इस तरह इक्वेशन करना है. COH group, COH group is esterified. That's why bicampicillin and pivampicillin both are the product for ampicillin. Now carboxypenicillin. So in that you have carbonicillin, then ticarcillin, carbonicillin and ticarcillin. तो अल्फा कार्बन एटम पे क्या रहेगा, कार्बोक्सिलिक ग्रुप रहेगा, कार्बोनिसिलिन. देन ticarcillin, ticarcillin में क्या है, so instead of this benzene you have thiophene ring over here, ticarcillin. Then iridopenicillins, iridopenicillins, so azocillin, mesocillin and piperacillin, there are three. So azocillin में जो अल्फा कार्बन एटम है वहाँ पे क्या रहेगा, यूराइड स्ट्रक्चर रहेगा. एडिशनली NHC double bond NH, that is a uride structure, NHC double bond NH, azocillin. Then piperacillin is there and mesocillin is there. So these are the penicillins. Now cephalosporins, they were first isolated from Cephalosporium acremonium. All cephalosporins, they are derivative of cephalosporin C. They act by preventing the cross-linking of bacterioglycan in the bacterial cell wall by inhibiting the transpeptidase enzyme. There are two kind of ring present in the